Hi, my name is Kayla Spicer and I'm a student at the College of Nursing. Today I'll be performing the medication administration checkoff. Here's my badge and scan the room. Okay, so to begin, I'm going to name the 5 rights of administering medication. So the first is the patient, right patient, then you have right dose, right medication, right route, and right time. For this checkoff, it is considered a no interruption zone, so I would have no ongoing conversations, phone calls, or anything that would distract me while drawing up the medication. So I'll go ahead and begin. I'm going to be comparing the MAR with the patient care order form. So I'm going to check for what the medication is that I'll be administering today, which I will be doing heparin. So heparin is on both forms. And I'm also going to look at the patient allergies. So my patient is allergic to penicillin. So I'll go ahead and examine the 5 rights that are located on the MAR and the order form. So the right patient is Mr. Jaguar Jones. Jaguar Jones. The medication is heparin. Heparin, 5,000 units for dose, 5,000 units. The route is subcutaneous, and it is every 12 hours. Okay, so I no longer need the patient care order form. I'm just gonna hang on to the MAR. So now I would perform hand hygiene. And I'm going to prepare the medication and gather all of my supplies. So first I'm going to get my vial of medicine. This is heparin, and I have 10,000 units per milliliter. And the expiration is December 5th, 2025, so it is still good to use. I'm also gathering my 1 milliliter TB syringe, an alcohol prep pad, and my tape for my label. Okay, so I'm going to begin by getting my alcohol prep pad and clean the vial. Going to get my syringe, and for the dose, since I have 10,000 units per milliliter and the order is 5,000 units, I will do half a milliliter. And I'll get half a milliliter of air in my syringe. Take off the cap. Put this where you can see. And then put this in the rubber portion, inject the air, pull up, and pulling down to half a milliliter. Okay, so at this point I would have the second nurse check my dosage, and I'll just pretend that you're my second nurse. I'll remove the needle and recap using the scoop method. Okay, so I'd verify that that is the correct dose. Okay, and I'm also going to get my piece of tape that has the information. So I'm gonna, at this point, I will compare this to my MAR and also use the tape. And this is my second check for accuracy. So I have Mr. Jaguar Jones. Jaguar Jones, the medication is heparin, and it is 5,000 units. Subcutaneous, so I have my subcutaneous syringe and needle, and it is given every 12 hours. The last one was at 7, so I will be giving this one at 1900. So I will place the tape on my syringe right there and take this and the MAR to my patient's room. Okay, so this is my patient. At this point, I'm going to walk in and perform hand hygiene. I'm going to verify my patient using two identifiers. So Mr. Jaguar Jones and date of birth, August 25th, 1963. And comparing that with the MAR, that is correct. And he is also allergic to penicillin. Okay, I would raise the bed to a working height and lower the side rails. And I'm going to put on my gloves and my goggles. Okay, at this point, I'm going to do my third check for accuracy before I inject the patient. So, Jaguar Jones, date of birth. Then we've got heparin, 5,000 units. So I have heparin, 5,000 units, aka half a milliliter. And this is subcutaneous every 12 hours. So all my information is correct. I'm going to explain the procedure to Mr. Jones, telling him that he will be receiving a heparin injection in the abdomen because it's subcutaneous. Okay, and if there were any kind of pre-administration vital signs or anything like that, I would go ahead and take those before doing the injection. I'm also going to clean the injection site. Well, I would expose the injection site, maintaining privacy, and then I will clean it. Since it is in the abdomen, I'd have to remove the gown. And I'm going in circular motions, moving towards the outside. And I'm just going to leave that pointing towards where I'll give my injection. Okay, whoop. Okay, so I won't need this piece of tape right now. I'll go ahead and uncap it. And since this is heparin, I will pinch the skin and go in at a 90-degree angle and slowly inject. And then I will release and put that in the sharps container. This is my sharps container that I just dropped it in. I realized that was out of the camera. And I'll hold pressure. Okay, then I'm going to dispose of that in my gloves. I'm going to lower the bed and raise the rails, position my patient comfortably again, and make sure there are no allergic reactions occurring. Then I would go ahead and document the procedure and how the patient reacted on the MAR, and I would come back in to check that there were no allergic reactions again. All right, and that concludes my video. Thank you.